Hi friends, in this today's video I will talk about 25% dextrose injection. First is the disclaimer. This video is made for educational purpose only and there is no endorsement for any brand or company. Friends, 25% dextrose comes as 25 ml ampoule or 100 ml infusion bottle. 100 ml of 25% dextrose contains 25 grams of glucose. In severe catabolic states, dextrose 25% supplies energy and it prevents further catabolism. 25% dextrose is a concentrated form, so it is very useful when faster replacement of glucose is needed, like in hypoglycemic coma. The patients in whom the fluid restriction is advised, that is, patients of congestive heart failure, patients with volume overload, cirrhotic patient, oliguric patients with renal failure. In these patients, 25% dextrose provides larger glucose in smaller volume and hence provides the nutrition. Indication for the use of 25% dextrose are it is used for rapid reduction of hypoglycemia or hypoglycemic coma. It is used as to provide nutrition to the patients on maintenance fluid therapy. It is also used in treatment of hyperkalemia when the patients of hyperkalemia when they are given insulin, then there are chances of patient going into hypoglycemia, so we give them 25% dextrose 100 ml with 10 units of regular insulin to prevent the hypoglycemia. The contraindications for the use of 25% dextrose are the dehydrated patients with anuria or patients with intracranial or intraspinal haemorrhage, and in patients with delerium tremens we should avoid 25% dextrose. It is also avoided in diabetic patients unless there is severe hypoglycemia. It has been seen that a rapid infusion of 25% dextrose can cause glycosuria secondary to hyperglycemia. So, in the absence of hypoglycemia, 100 ml of 25% dextrose should be infused slowly over a period of 45 to 60 minutes. The common side effect which is seen with 25% dextrose injection are pain, swelling, and redness at the site of injection. Dr. Bernice Siegel has said, the art of medicine is not just about treating the disease but also about treating the patient's mind and spirit. With this, I conclude today's topic. Thank you. Keep learning.